By regular cough syrups or your day-to-day medications, even then it is not going away. You have a smoking history or not, or that cough generally converting into breathlessness. You better get yourself evaluated thoroughly with generally by seeing your physicians or your pulmonologist or let's say an oncologist and get yourself thoroughly evaluated. Coming to the GI related cancers, I would say the symptoms can be as vague as an acidity. Okay, so post 50 acidities, unexplained weight loss, loss of appetite, any blood in your stools, any change in your stool color. Let's say the stool color is generally yellowish. If it is blackish, meaning some blood has released from somewhere in your gut and then added into your stool, and then that changed the color of your stool. So, and fullness of your abdomen. So symptoms can be as vague as these. I'm not saying all these symptoms can be cancer, but in at least 2 out of 10 patients, these symptoms can be related to the cancer symptoms. So all I'm trying to say is thoroughly evaluate yourself at the slightest beginning of a symptom. If you are more than 50, more often than not, 8 out of or 9 out of 10 times, it could be a vague acidity or a gastric ulcer or something. But then we are sitting in an era where majority of our cancer diagnoses are being missed, or we are diagnosing them in late stages because of the symptoms which are generally vague and mild. And majority of the time, patients tend to ignore relating to their age, or sometimes we tend to be busy, and then because the symptoms are very mild, we tend to reach our doctor's late, and by then we're already a little in an advanced stage. So at the slightest origin of a symptom post 50, better get yourself thoroughly checked. A good way of doing, good way of maintaining healthy lifestyle is by inculcating an yearly health check. So that's what I wanted to speak, at least in terms of cancer screening. And then I had a small quiz which I wanted to engage all you guys with, if this permits, a small cancer related quiz where people would be interested to know a few things. So maybe at a later date.
Yeah.
So if there are any questions.
Yeah. Thank you, Sir Chandra Garu, for your valuable session. We can take up the questions now. So.